Hi everyone. So today I wanted to talk to you a little bit about what happens when you hit a plateau or a snag on your weight loss journey using GLP1s. If you haven't listened to me before, we're talking about medications like semaglutide, which is Ozempic and Wegovy, and tirzepatide, which is Mounjaro and Zepbound. Now, I want you to remember one thing before we even go any further. When you're on your weight loss journey, be gracious with yourself. It's not an easy journey and it takes a lot of dedication and a lot of work, and we know that as your physicians. So be gracious to yourself. Also, remember that they are medications and they don't work the same way for everyone, meaning it may not work at the same pace. And like we explained in other videos, the process does involve gradually titrating doses upwards to get you to doses that work for you. So what happens when you're on these medications and you seem to hit a plateau? So either your weight's not going down anymore, or it's hovering around the same, up by a pound, down by a pound, or you're not losing anything, you're gaining more weight. It can happen, and it's not something to be frazzled about. It's not something that means that medication isn't working. It happens. With each dose, what you find is that patients might hit their plateau with that particular dose after about 3 months or so. So technically you can stay on the same dose as long as it's working for you. But bear in mind, you might get to a point where it stops working, and in that case, you can increase the dose. However, what I want to talk about is what happens when it's not the dose that needs to be increased. Ideally, we want to keep you on doses for as long as they're working so that we don't run out of doses while you're on your journey. So we don't want to increase the doses too quickly just to push your weight loss too fast. And we'll talk about that in a separate video. What are some of the risks of losing weight too quickly? But for this one, we want to focus on what it could mean if you've sort of hit a plateau with your weight loss. And like I mentioned, one of the things could be that that dose may have run its course and the dose needs to be increased. Outside of that, there are certain things that you need to look at when you're on your weight loss journey. One of those things that are really important is, are you getting enough protein in your diet? So if you find that you've hit a snag, revisit your diet. Are you getting enough protein? Are you doing your weight training or resistance training, which will help you to build muscle? Now, that's not just important overall to prevent muscle loss or sarcopenia. That's also important because muscle does help with your metabolism. If you have less muscle, your metabolism is slower. So if you're on this weight loss journey, then increasing your metabolism by boosting your muscle mass is a definite priority. So you want to make sure that you're doing your weight training, your resistance training, that you're getting enough protein in your diet, and you can discuss that with your physician or your provider. How much protein you should be getting, but revisit your diet. The other thing is to make sure that you're hydrated. Revisit that. And a lot of things that have come out in studies and research lately is the importance of sleep. So I want to look at other lifestyle factors. Sleep and stress are two of those big factors that they have found actually can impact your weight. And so if you've hit a snag, it's not the dose, it's not your diet, you're doing your exercise, it could be that you're not hitting your sleep goals. So you should be targeting your sleep. So make sure that you revisit, are you sleeping well? How are you handling your stress? Because stress is a whole other arm of weight management, as many of you might know. You also want to make sure that you've covered other illnesses with your physician. So anything else that might impact your weight, things like stress hormones, cortisol levels, things like thyroid disease that could impact your weight and metabolism. So you want to visit those as well. And then the last thing that I want to say is not to compare yourself with others. That's really, really important on this journey because it's very easy to get frustrated. We gain weight and it takes time for you to gain the weight, but when it comes to the weight loss side, we all want to see it go really quickly, and it's very easy as humans to become very frustrated very quickly. Be patient with yourselves and don't compare. I'm talking to you ladies in particular. Remember that men will lose weight differently. So for my male patients, yeah, you all will lose weight differently than the woman will. So for my ladies out there who are on this journey with a male partner, please don't compare yourself to them. If you have lost 4 pounds in the month that went by and they have lost 10, please don't be frustrated. Again, be gracious with yourself and do not compare. For each person, the journey is individual. The medications work and they work really well, but they don't work the same and at the same pace for everyone. So bear that in mind. So a couple things for you to factor in. If you've hit a snag, hit a plateau, discuss it with your provider, because there are options. There are different things that might have caused it and different things that can be addressed. All right, see you later.